Is there such thing as a happy denture wearer? I mean, I know a few people that have dentures. I never hear them complain about it at all.
They're not happy.
Really? Okay.
You know,
well, obviously they're not going to tell me, I guess.
No, they don't tell you. And by the time they come in to tell me, they've really had it. I mean, they may have been at a function. I had a guy who was a coach in a high school, local high school. He's wearing the dentures, and he's trying to shout at one of the players. And what happens? His teeth fall out.
Really?
So he's got to cover it up because he can't be weak in front of his football players now. Come on. So, I mean, that was his reasoning for coming in.
Is there usually like a breaking point for these denture wearers that finally say, I got to do something about it?
Right. So it's either a pain situation, maybe that the denture has become so uncomfortable they really just can't tolerate it anymore. You'll be surprised. A lot of women wear dentures for a million years and never take them out in front of their husbands, even when they go to bed. So at some point when it becomes really intolerable, that's when they come in. I mean, they've just had enough. Because
70, 60, I mean, they're still on Match.com, they're dating. I guess, for kissing and things like that would be very uncomfortable.
Absolutely.
Or a person could be self-conscious about it.
Yeah, so the internet dating thing, I mean, it's...
What are the misconceptions? We're going to take a break, but what are the misconceptions about dental implants that are out there in the denture wearer crowd that you hear that just aren't true?
I think the biggest misconception is that you need an implant for every tooth.
Okay.
And then they think you're going to just come in and drill a bunch of holes and screw these things in. They already have teeth on them. That's not really the way it works.
Okay, good. We're going to take a break. We come back, more of those photos. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, more about the process. If you have a loose-fitting denture or are missing just one tooth, you got to see this next segment. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. With us, we have an expert on the topic, a board-certified oral and maxillofacial surgeon, Dr. Ornstein. Okay, so you have photos, and we were discussing at the break about changing people's lives. That for some people, it's life-changing.
We have patients that come in and they people always think they're mad or stuck up or something like that, but it couldn't be further from the truth. Here's a lady that kind of looked that way. Everybody thought she was mad all the time, and for her, she'd been wearing this denture for about 1 million years. So she came in, she wasn't happy with it, she wouldn't smile because it kept falling out.
So she did have a denture?
She did have a denture, and she was sick of using the adhesive. And that's a thing I want to point out about the adhesive real quick. The latest information on that is that those adhesives contain zinc, and zinc is toxic to the body. So if you're using, a half a tube or a whole tube a day to keep your dentures in, that stuff is making contact with your tissues all the time. And people have crazy medical side effects like tingling, numbness, pain, fatigue, stuff like that. So that's the latest studies about adhesive. So we really need to do something about that, get rid of those dentures and get some implants in. So,
all right.
This lady came in, she didn't have any of those issues, but she wasn't happy, and that's evident in her non-smile. So we put 4 implants in her upper jaw. She said she didn't want to have to stick that thing in the glass at night. At least not both of them. So we put 4 implants on the top. This was a fixed prosthesis, which means...
So it stays in her mouth?
Which means it stays in.
Okay.
We put the 2 in straight in the front, angle the 2 in the back to get that cross-arch stabilization that we talked about, and the thing's screwed in. She doesn't have to worry about it. The other nice thing, and I've got a model of that, that we have here. It doesn't come off, and I'll show that to you.
It's just fixed?
It's just screwed in.
Interesting. Okay, so the rear are just angled.
Right.
So it doesn't flip up in the back.
Exactly right.
Good.
And the other great thing about that is that there's no plastic covering up the roof of the mouth.
Okay.
My mom wore a denture for a number of years, and I used to wonder how she could drink the tea with it still bubbling in the cup. It was so hot, and the food was also spicy, she couldn't taste it. She couldn't feel it. So with this technique, there's no plastic covering the roof of your mouth. You can feel the texture of the food. You can taste the food. It's really phenomenal.
Okay, so you gave her that on the upper. What about the lower?
On the lower, she opted to go with the 2 implants, the snap-in, snap-out option on the bottom. And that worked great for her. The lady actually had a ton of bones. She had more than usual. I had to take some away. But whatever it takes to make it work. And she was so happy with it. I mean, look at this smile. I mean, you can't believe the difference.
Like the same woman.
She actually has a smile now. And so she's very happy with the result. She's more animated. She's confident.